Hello, I'm Raquel Castro, Social Policy Director to World's Rare Disease Europe. Thank you for inviting me to speak at your national conference. I'm sorry that I cannot be with you today, and I'm very happy for this opportunity that you gave me to send you a video message. I hope that it will inspire your discussions today and also the update of your national plan. And I'm going to bring you today two topics very connected to your discussions, as the initiative that I will present to you today was both a lot related to patient engagement and having the patient at the center, as well as to the collaboration between the different stakeholders. So the way I'm going to tell you about patient-centered care and patient engagement is really through the experience of an European project that just ended called InnovCare. That was an European consortium with members from different countries, and Eurodis was one of the partners involved in this project. And what was at the basis of this project in relation to what we know about rare diseases was really mostly that difficulty with the care pathways and how it is difficult to coordinate between health, social and local services due to the different specificities of rare diseases. And also what we had in our mind when developing the project is that we thought that if we develop a system that works or various ideas that work for rare diseases to integrate, to work on a holistic perspective, an holistic care pathway could work for other complex conditions, disabilities, chronic diseases, and socioeconomic vulnerabilities. At the basis of InnovCare and in parallel with InnovCare, the Commission Expert Group for Rare Diseases, which was composed of representatives of all member states, was working on recommendations to support rare diseases with daily life issues and social care issues. And in those recommendations, the member states' representatives and all stakeholders stated that the serious unmet social needs of people with rare disease and their carers and their families affect their dignity, autonomy, and other fundamental human rights. So really going into acknowledging the impact on human rights, which I know is also one of your topics today. And this Commission Expert Group recommended that member states should promote measures that facilitate multidisciplinary, holistic, continuous, person-centered, and participative care provision. So really the patient-centered and participative, but also the coordination between carers and everything done in a holistic perspective in order to really help people with rare disease to fully benefit from their human rights. And I'm only extracting this one recommendation, but they are very rich. In case you haven't come across them, you will find them in the link at the bottom of this slide, and I really encourage you to visit these recommendations, but also the other recommendations of the Commission Expert Group on different topics in rare diseases. At the beginning of InnovCare, we conducted a survey at European level, so to really start from the needs of patients and carers. And we conducted a survey with 3,000 participants across European countries. And you will find here all the links to the reports with the results. The survey was conducted here through Eurodis survey initiative, Rare Barometer Voices. And with this survey, we saw really the figures. We collected really the impact on daily life that rare diseases are generating, both for the person with the rare disease as well as for the carers, family members. And we saw that the impact is across activities of daily life, disability, time burden. There is a strong impact on employment and economic burden. The care pathways are indeed complex and hard to manage. There is lack of information, social services are badly prepared, and we also saw an impact on mental health. In terms of impact on daily life, and a significant number of people with rare disease have reported having difficulties with a wide range of issues in daily life, going from simple activities to impairments, functional impairments, to taking care of administrative tasks and also controlling behavior, understanding and learning. So really a broad impact across daily life aspects. We also saw that the symptoms vary and can be invisible, something we already know, but now we have reports also from patients on how you appear completely healthy in one day and you may be sick on the next day, and how hard it is to really get that message and that visibility for that situation. We have seen as well with this survey that there is a time burden for both the family member and the patient. 42% of the respondents spend more than 2 hours a day on illness-related tasks, not including the care pathway, but really just the hygiene, the treatments, and helping around the house and to move. And 30% of the carers spend more than 6 hours a day, which is a significant part of the active day. And we saw also in the survey from the patient's perspective what we have been seeing, many of us across European countries, that the care pathways are complex and hard to manage. 65% of the respondents have to visit health, local and social services, different services in short periods of time. 67% find that these services communicate badly between them. 7 in 10 of the patients and carers do not feel well informed about their rights. And 7 in 10 find that organizing care is time consuming. So going from one service to the other, actually having the service provision, finding the services, etc. 7 in 10 of the people living with rare disease and carers who responded had to reduce or stop their professional activity due to the disease. And the rare disease also led to an income decrease for a similar number, 69% of the respondents. In terms of mental health, people living with rare disease and their carers were three times more people with rare disease reported being unhappy and depressed in comparison to the general population. The Innov Care project really started with the results of this survey, and so to build solutions to address the needs of patients and carers. And even before the survey, the mission that was defined was really to try to find ways to bridge the gaps between health, social, and local services to improve care provision. And one of the activities proposed within the project was to implement a pilot of case management for rare diseases, where the case manager would play this role of being the single contact and also connecting all the services, whether those are the health services up to the specialized services in the centers of expertise and then linking to ERNs, whether that is the social services, the specialized social services, and of course all the services that the patients need to access on a daily basis, local and community services. Of course, all in link with the patient organization who is a big support, and also many cases becoming service providers. And also within Innov Care, we have build up a network, an European network of resource centers. So these resource centers already exist. You may have heard about Ogrenska in Sweden, or Frambo in Norway, or Noro in Romania, which is where the Innov Care pilot actually took place. So these services are now gathered in one network as well, with the support of this European project. During the project, we worked with different stakeholders across 4 workshops, in a total with 100 people who participated from 24 countries across Europe. And we had also an advisory group with representatives from national competent authorities and national level. And within this group, we were fortunate to count on the input and engagement of Elena Karaenian. And we did a lot of work here to find good practices, recommendations, and really direction and guidance for member states and for different stakeholders in trying to develop integrated health and social care for rare diseases. All these while taking into account the work of the Commission expert group, what was happening with the European Joint Action on Rare Diseases, both at the European level, but also the national workshops that were being conducted to support the national plans. And of course, thinking of the ecosystem also now with the European reference networks and how the European reference networks can help this integrated care provision. I would like to tell you a little bit more about the pilot of Innov Care, which was focused on case management for rare diseases, and the role that was defined with all the stakeholders for this pilot, which took place in Romania, in one region in Romania, was that the case manager would be the main and stable point of contact. He would inform, support, and empower beneficiaries, so people with rare disease, and professionals. And he would also work on the holistic and person-centered care provision, really that that one of the main goals. And the objectives were to improve the level of knowledge of the patients and carers, to improve their capacity to manage their own care, and to improve also their communication skills. On top of that, to improve the peer support, so that patients support more each other, to support the coordination between different health and social services, really one of the core missions, and then, if possible, to help prevent situations that would be of risk if the case manager was not there. And all this was developed, of course, with input from the patients, both because of the survey, but also the patient organizations involved in the workshops, and the actual service provider in this case was also a patient organization. And side by side, we developed also an outline of a training for case managers. So if you are interested in that in Finland, to see how the case managers were trained, you will find here the actual contents of the outline of the training. So the pilot of case management was developed in Romania, in one region, with 2 full-time case managers, and each of the patients and families who accessed the survey were accessing the service for 9 months. And there were over 120 people receiving the service of the case managers, with different levels of functioning, so different levels of disability, and also different ages, across ages. And within this population that received the case management services, there were over 30 rare and complex conditions, some undiagnosed and some also not rare, so a big diversity in terms of the population. And the case management impact was evaluated, so the intervention was designed in a way that it would be evaluated with a robust evaluation model, which you will find here. Just for you to have the quick overview, there were 2 groups, and they were receiving the intervention in 2 different moments. And I will leave you the slides so that you can go through the details of how and what we would expect. But this type of model allows us to see differences between the groups, so to assess differences between the groups and within the group before and after the intervention. And so this evaluation was done by the Center for Social Innovation in Austria. And what we see as an outcome of this evaluation is that the case management did improve beneficiaries' level of information on services, so available services, on their rights, and about their disease. We have also seen that the case management increased the beneficiaries' level of the beneficiaries' communication skills, and it improved the coordination of care. And we also saw that the case manager increased the beneficiaries' capacity to manage their own care. So people living with rare disease and carers who were receiving the case management were becoming more empowered, more capacitated to manage their own care. In terms of the burden for the caregivers, and using a standard measurement for the Zarit caregiver burden, we saw that the carers who were facing mild to moderate burden and high burden saw a reduction in the burden that they were facing. And this is also a very interesting point to keep in mind. And we can ask ourselves, so the information improved, the patients were more informed than the carers, and there was capacity building, but what does that really lead to? And so 2 case studies, 2 real stories here will give you examples of what the outcomes may be. And so we have one patient who managed to get employment, rehabilitation, and peer support after the support, or with the support of the case manager. And another case you will find here is one patient who had disability. With the help and support of the case manager, he was able to secure a wheelchair that he was in need of, and also a personal assistant. So this is really impact for the patients, but also for Romania. This experience and the good practice and the results that are coming out of it are also supporting the implementation of case management services in Romania for other conditions. So really giving input into policy making as well. So we can say that case management works from the experience of in-home care. And another interesting point was that the improvements on the first cohort, so the ones who received the intervention first, were sustained in the 9 months after the intervention where they were not receiving intervention. So that would be very interesting to explore if this was sustained for longer, which would really make case management such an interesting, even more interesting service. And there was also less use of emergency hospital services and less hospitalizations. In case, in order to have more impact on quality of life, a longer long-term intervention really would be needed, and also quality of life instruments that allow us to capture what quality of life aspects may the case managers be influencing. Just a quick note on the European Network of Resource Centres that it may be interesting for you in Finland. We did have colleagues from Finland coming in to the meetings as well, although no Finnish services yet involved. But this network is really working on holistic care, and it's a complementary network to the European reference networks, as they are not healthcare providers. But they are really working around the networking, mutual learning, knowledge and sharing expertise. So really useful to connect to, and so don't hesitate to reach out to this network. And so really what would we expect with the implementation of InnovCare and with the similar services? So really with integrated care for rare diseases, we would expect to achieve better health and social outcomes, to relieve and empower the patients and carers, increasing their social participation, and hopefully also to elevate the care system, really to create gains for the system, because the services should be more coordinated, working more efficiently, and really so altogether there would be a broader societal change and hopefully leaving no one behind. And the key areas that were identified, so if we want to really implement integrated care, for our diseases, integrated health and social care, with the work of many experts in the project, there were 3 areas identified as really the 3 main bottlenecks or points, areas to invest to really achieve this. The coordination between public bodies, the multidisciplinary teams and care coordination, and the empowerment of beneficiaries. So very much aligned with what you are discussing today and what you are taking into account to update your national plan. And so we would like to leave you with a few recommendations which were not designed specifically for you in Finland, but we believe that they can inspire you as well. And they come really from the work of all the experts, not just the partners, but all the experts involved in InnovCare, including those from Finland who were joining the working group. And one of the key points is really to create a supportive political environment at national level. And some ideas for that. The working groups between ministries, dedicated, coordinated, shared budgets between public bodies, top-down but also bottom-up approaches, so really working on both the policy level but also the grassroots and taking from the field what is happening and what's the good practice, and including health and social care within national policies, so within the National Plan for Rare Diseases, for example. And another area to invest is really to implement mechanisms that support the integration of health and social, and within health and within social. So really the full integration and the empowerment of beneficiaries. And those can go across ensuring financial and structural support to platforms that actually work at national level to really ensure the gathering of knowledge and the sharing of expertise, pilot projects which can bring really good practice and inspire the implementation of services at national level, training for care providers, really an essential point across the different domains of care. One other idea that came was requiring coordination between care providers in public tenders, for example, putting in place multidisciplinary care teams, implementing services that may facilitate integrated care, for example, the resource centers or the case managers, which were 2 types of services used in InnovCare, but maybe other services that also make sense in the context in Finland, for example, and then engaging beneficiaries, of course, in the design and implementation of services, so really ensuring mechanisms for that. And the third point would be also to make full use of the EU instruments to develop integrated care, of course, at European level, but for you in Finland also at national level. So there is the new multi-financial framework that will come up at European level. So really, hopefully, and we're pushing, so we can all push together for it to support EU-wide platforms and innovative pilots that, as the European Joint Action or as InnovCare, we're really bringing in and transferring expertise, allowing countries to learn from each other and to take from each other and to build together. But also at national level, the European structural funds that you can see in Finland, how can you use them to support member states to really to support Finland to actually implement these kind of models for integrated care. We have a set of recommendations published within InnovCare, which I will leave you the link here and you will find them. They connect also, of course, to other initiatives in rare diseases, the European Reference Networks, Orphanet. They talk about the previous joint action, so really about the important ecosystem of rare diseases. And one of the recommendations, which I will leave today for you, is that the partners in InnovCare recommended that national strategies and national plans for rare diseases include the provision of integrated care and services for people with a rare disease. So something interesting to leave also in the air for your discussions today. I also encourage you to go through the good practices that are available coming from this InnovCare project. And one that I did not emphasize that much, but I would like to now, is that we also worked on identifying the potential role of ERNs in supporting this integrated care, and together with the joint action, with RD Action. And there will be a document coming out soon as well with this role that ERNs can take. And for the other documents, you can find them in the links at the bottom of this presentation. I hope that this will bring good points for you to continue the discussions today. And if you have any doubts or questions or would like to have more information on any of the points presented, do not hesitate to contact me at the email you will find in this slide. And I wish you a very good continuation of your discussions today. Thank you.